Thank you, Mr. Speaker, and it's an honor and privilege to rise today to discuss Bill C-323, an act to amend the Excise Tax Act for mental health services, which is great to see this bill come forward, Mr. Speaker. This bill would add psychotherapy and counseling to the list of healthcare services exempt from point-of-sale taxes. And as you can imagine, New Democrats are very much in support of this. My colleague from London Fanshawe tabled Bill C-218, which would also remove GST from psychotherapy services, which is currently outside of the order of precedence. And another of my NDP colleagues have tabled this bill for the very same thing back in 2017. So we've been fighting for this for years, Mr. Speaker. But Mr. Speaker, I do want to highlight a couple of things. This bill is actually encapsulated in the budget bill, Bill C-69, which the Conservatives who are bringing this bill forward voted against, Mr. Speaker. This is actually hypocrisy that they're bringing forward this bill that is now in the budget bill, and they can support the budget like, you know, we've had to do. We've had to work with the government. There's things that we don't love that they didn't do, Mr. Speaker. I supported the budget and got the firefighter tax credit for volunteer firefighters and search and rescue doubled, Mr. Speaker. Those are things that we do. I heard one of my colleagues from Battleford, Lloydminster, complain that the government stole her bill. That's actually our job in opposition, Mr. Speaker, is to bring good ideas to government, have the government see that they're good ideas, and then take them. That's the idea. That's a good thing, Mr. Speaker. So today is a good day that this bill was encapsulated in Bill C-69 in the Budget Implementation Bill. And it's something, again, that New Democrats have led the charge on. And, Mr. Speaker, it brings me back to when I think about the Excise Tax Act. My predecessor, John Duncan, who was an MP in this place for 18 years, and James Lunny, who was an MP for 15 years, both Conservatives, total of like 33 years that they sat in this place. They did get one bill passed, and it was actually changing the excise tax. But get this, Mr. Speaker, it was to remove the excise tax on jewelry. So you could get your diamonds cheaper, Mr. Speaker. That's who they were fighting for. And I can't even make this stuff up. So it's good to see Conservatives come here today and bring forward legislation that's actually going to make a difference in people's lives, not just the wealthy and the well-connected, Mr. Speaker. And, Mr. Speaker, I'll get to the crux of it. We know physical health services are typically included in our universal healthcare system, or at the very least, they're exempt from sales taxes. That's critical. We're proud of our universal healthcare system. We need to do much more, Mr. Speaker. But mental health care, it's not included in our healthcare system. We have a two-tiered healthcare system in this country right now.